Good evening to all of you. Welcome to today's important session. Today we'll discuss about the Odisha SSSC Nursing Officer Recruitment Examination Probable Multiple Choice Question with Explanation, which is basically based on the NCLEX pattern. Today I will discuss about the Day-8. So before starting of today's session, you must have to take care yourself against pandemic COVID-19. मेहनत इतनी खामोशी से करो कि सफलता शोर मचा दे. So let's come back to the first important question. The following delusions are common in depression except A options delusion of poverty, B options delusion of nihilism, C option delusion of grandeur, D option delusion of persecution. So which delusions are common in depression except one? Okay, there are four options has given to you. Just you have to choose the except, meaning which is not the common delusion in depression. So here that answer will be the delusion of grandeur. You must have to remember this one. Answer will be the C option. Now we'll come back to next question. The nurse is caring for a patient who is bleeding from the puncture wound. Which of the following interventions should the nurse use to control the arterial bleeding? Pressure at the puncture site. B option application of a tourniquet. C option में pressure point massage. D option pressure dressing. So what would be the right answer here? Answer would be the nurse is caring for a patient. Nurse is caring for a patient. Puncture wound. Patient has already been puncture wound. Where that bleeding is going on. Bleeding is going on. So what kind of intervention will be taken place to control the arterial bleeding? Always you have to remember the answer to be the E option. That is the pressure at the puncture site. Now we'll come back to next question. Answer is E option. Which of the following actions should be taken first for a patient who is found with hypothermia? A patient is already been hypothermia. So what should be your duty? To take first action. Undress the patient. B option use tepid water as mist spray. C option remove patient from the hot environment. D option place in continual breach from electric frame. So here that answer would be the C option. Remove patient from the hot environment. Answer is C option. Now we'll come back to next question. Which of the following would the nurse reinforce after a teaching session as the most important lifestyle modification for the patient who is age 59 years of age, 5'4", 11 inch, weight to 80 pounds and is hypertensive? So what should be your teaching session? Reduce weight, restrict salt intake, increase potassium intake. D option decrease alcohol intake. So here answer would be the reduce weight. Answer is E option. Now we'll come back to next question. Which of the following actions should the nurse prioritize when taking care of a patient with platelet count of 23,000 per kg of blood? Request an order for an anticoagulant. B option protect the patient from injury. C option encourage the patient to drink plenty of fluid. D option no action is necessary. So here answer is, what would be the right answer of this question? Your answer will be the protect the patient from injury. Unless and until that patient platelet count is low. Now we'll come back to next question. How would the nurse record smoking history on a patient who has smoked 2.5 packs of cigarette per day for 10 years? Patient has smoked cigarette for 10 years. Patient smokes 2.5 packs of cigarette per day. Patient has a 12.5 pack a year smoking history. Patient has a 25 pack year smoking history. So what would be the right answer of this question? Answer would be the D option. You all have to remember this one. Which terms should be used to document the musical sound generated by airflow through narrowed airway? Crackle sound, wheezes, friction drop, and the D options you are getting stridor. So what would be the right answer of this question? Here that answer will be the wheezes. Okay, wheezes. You all have to remember this one. Now we'll come back to next question. Which laboratory result should alert the nurse to perform further assessment on a patient admitted with respiratory distress? Okay, partial pressure of carbon dioxide is less than 50 millimeter of mercury. Bicarbonate ion less than 27 millimeter of milli equivalent per liter. Partial pressure of oxygen less than 90 millimeter of mercury. D option, SpO2, oxygen saturation is less than 90. So here that answer will be the D option. Okay, you all have to remember this one. Answer is D option. Now we'll come back to next question. After a laryngectomy, which of the following assessment takes priority? Airway patency. B option, nutritional status. C option, lung sound. D option, patient acceptance of surgery. So what would be the right answer of this question? Laryngectomy. Okay, you all have to remember this one. So what should be your assessment which takes priority? So here that answer will be the A option, that is the airway patency. You must have to remember this one. Now we'll come back to next question. Which of the following assessment findings does the nurse expect in a patient with emphysema, purulent sputum, diminished breath sound? C option, generalized edema. D option, dull chest pain. So what would be the right answer? Diminished breath sound. B option is the right answer. You all have to remember this one. Now we'll come back to next question. A patient with shortness of breath is being tested for lung cancer. This diagnostic will be most conclusive. Chest X-ray, MRI, sputum culture, biopsy. Most conclusive. Okay, here 4 diagnostic tests has already been given to you. Just you have to choose. Okay, one which is most conclusive. So here that answer will be the D option. Biopsy is very important. Now we'll come back to next question. The nurse is collecting data on a patient with ruptured appendix. Ruptured appendix is in pain, where the nurse expect the patient to locate. Right upper quadrant, right lower quadrant, left upper quadrant, left lower quadrant. Okay, always you have to remember there are abdominal cavity. Okay, divided into 4 quadrants. This one is the right upper quadrant. This one is the right lower quadrant. This one is the left upper quadrant. This one is the left lower quadrant. Okay, so just you have to imagine this one is the umbilical. So okay, here you are getting McBurney's point where that pen is located. Okay, rupture due to rupture. So this one is the right lower quadrant. You all have to remember this one. Okay, B also. Now we'll come back to next question. The nurse is caring for a patient who is receiving a parenteral nutrition infusion. The nurse should perform blood glucose monitoring every 6 hours to detect which complication. Okay, a patient who is receiving parenteral nutrition infusion. Okay, nurse is monitoring 6 hourly blood glucose level. For why? For know about to detect what kind of complication: hyponatremia, hyperkalemia, hypocalcemia, hyperglycemia. So what would be the right answer of this question? Answer is D option, that is hyperglycemia. Now we'll come back to next question. The nurse is reinforcing patient teaching. Which of the following food would the nurse reinforce that the patient with ulcerative coli is to avoid? A option में fresh fruit, B option white bread, D option sweet dessert, D option meat. So what would be the right answer of this question? Ulcerative colitis. What would be the right answer of this question? Answer would be the A option. That is the fresh fruit. You must have to remember this one. Now we'll come back to next question. Which of these patient dietary habit does the nurse understand may increase the risk for development of colon cancer? Okay. If there are 4 options has given to you. Okay. Out of that, you have to choose one which is responsible for the development of colon cancer. Okay. Or increase the risk of colon cancer. High fat and low fiber intake, high intake of milk and milk product, low meat and protein intake. D option, low fat, high carbohydrate intake. So here that answer is E option. You must have to remember this one. Now we'll come back to next question. The nurse is planning care for a patient with cirrhosis of liver. For which condition would the nurse place the patient on bleeding precaution? Encephalopathy, low vitamin K, elevated liver enzyme, hepatorenal syndrome. Okay. Suppose a patient came to the medicine ward with having the cirrhosis of liver. At the same time, that nurse is planning care. So, for which condition would the nurse place the patient on bleeding precaution? So, you all have to remember low vitamin K. You must have to remember this one. The nurse is collecting data for a patient who developed jaundice and dark amber color urine. The nurse recognizes that which of the following is most likely the cause of these maladies: encephalopathy, pancreatitis, bile duct obstruction, cholecystitis. So here that answer will be the bile duct obstruction. You must have to remember this one. Now we'll come back to next question. The nurse is caring for a patient with acute kidney injury. Which of the following actions should the nurse take to obtain the most accurate assessment of fluid balance for the patient? Document voiding pattern, obtain daily weight, review laboratory studies. D option, observe skin trouble. So what would be the right answer of this question? What would be the right answer? Okay. Here that answer would be the B option, obtain daily weight. This is very, very important question. Now we'll come back to next question. The nurse is checking patency of a new right arm arteriovenous fistula. What action does the nurse use to do this? Auscultate the right brachial pulse. B option, auscultate and palpate the right radial pulse. Measure blood pressure in the right arm. Palpate for thrill and auscultate the fluid over the fistula. Arteriovenous fistula. So what would be the right answer of this question? Here that answer will be the D option. You all have to remember this one. Answer is D option. You all have to remember this one. A patient is scheduled for a right total hip replacement. The nurse should teach which of the following post-operative leg position: maintain legs in adduction, maintain legs in abduction, maintain internal leg rotation, maintain more than 90-degree hip flexion. So what would be the right answer of this question? Here the answer will be the B option. Maintain legs in abduction. Okay. Now we'll come back to next question. The nurse is caring for a patient immediately after a below knee amputation. Which of these assessments should the nurse consider a priority? A option, sacral edema. B option, mobility. C option, storm detection. D option, blood sugar level. Okay, here that answer would be the C option. You must have to remember this. Now we'll come back to next question. Which of the following is a symptom of increasing intracranial pressure that should be reported immediately to the healthcare provider? Constricted pupil. B option, decreased level of consciousness. C option, narrowing pulse pressure. And D option, bradypnea. So what would be the right answer of this question? So here that answer will be the decreased level of consciousness, because increasing intracranial pressure that should be reported immediately, okay, to the healthcare. So that is the decreased level of consciousness. Now we'll come back to next question. How soon after symptom onset must a person who has had a stroke receive thrombolytic treatment? 30 minutes, 1 hour, 2 hour, 4 to 5 hours. So what would be the right answer of this question? Here the answer would be the 4 to 5 hours. D option. Now we'll come back to next question. When caring for a patient admitted with Guillain-Barré syndrome or GBS, which nursing diagnosis should take priority? Anxiety, imbalanced nutrition, impaired gas exchange, impaired mobility. So answer would be the impaired gas exchange. You must have to remember this one. Now we'll come back to next question. A lethargic patient who has fever, vomiting, headache, and the nurse has to prepare him for which one of the following procedure? Blood culture, lumbar puncture, okay, computed axial tomography scan. Another one is the ultrasound scan. So here the answer will be the lumbar puncture, or the patient is suspected from meningitis. Patient, lethargic patient. Now we'll come back to next question. When caring for a patient after cardiac catheterization, which nursing care action is most important? Administer oxygen, provide rest, check the ECG every 5 to 15 minutes, check the pulse distal to the insertion site. Okay, cardiac catheterization. Nursing care action is most important. That answer is D option. Check a pulse distal to the insertion site. Now we'll come back to next question. The nurse is caring for a patient who had a splenectomy. Okay, spleen has already been removed in the immediate post-operative period. For which complication should the nurse specifically alert in this patient? Infection, peritonitis, intestinal obstruction, abdominal distension. So what would be the right answer of this question? Here that answer will be the abdominal distension. You must have to remember this one. Now we'll come back to next question. A patient is admitted with suspected atelectasis. Which clinical indication can the nurse expect to identify when assessing the patient? Slow deep respiration, diminished breath sound, a dry unproductive cough, D option normal oral temperature. So what would be the right answer? Suspect atelectasis. Okay, or collapse of the lungs. So what would be the right answer? Diminished breath sound. Okay, you must have to remember it. Now we'll answer is B option. Now we'll come back to next question. What nursing action will most help a patient obtain maximum benefit after postural drainage? Administer PRN oxygen, place the patient in a sitting position, encourage the patient to cough deeply, encourage the patient to rest for 30 minutes. So what would be the right answer of this question? Here that answer would be the C. That is the encourage the patient to cough deeply. You must have to remember this one. Now we'll come back to next question. The nurse administer oxygen at 2 liters per minute through nasal cannula to a patient with emphysema. For which clinical indicator should the nurse closely observe the patient? Cyanosis and lethargy, anxiety and tachycardia, drowsiness and decreased respiration, hyperemia and increased respiration. So what would be the right answer of this question? Answer is drowsiness and decreased respiration. You must have to remember this one. Now we'll come back to next question. The nurse is administering oxygen to a patient with chest pain who is restless. What is the method of oxygen administration that is least likely to increase apprehension in the patient? Cannula, catheter, venturi max, rebreather max. So what would be the right answer? Here that answer will be the cannula. You must have to remember this. Now we'll come back to next question. Which medical diagnosis can the nurse expect when collecting a health history from a patient who is scheduled for an aneurysm? removal of the antrum, cataract, gastric ulcer, osteosclerosis, trigeminal neuralgia, gastric ulcer. Answer would be the gastric ulcer. You must have to remember this. Okay, answer is B option. Now we'll come back to next question. When considering a patient symptom, how should the nurse categorize a patient complaint of tinnitus? That patient is complaining, I am having tinnitus. Whether it is the subject, okay, objective, subjective, prodromal, and functional data. So what kind of data it is? It is a subjective data because patient is complaining. A patient is scheduled for a hemorrhoidectomy. The nurse should observe the patient for the presence for which common clinical indicator associated with hemorrhoid. Okay, pruritus, flatulence, anal stenosis, rectal bleeding. Okay, D option, that is the rectal bleeding. Now we'll come back to next question. A patient with spinal cord injury has paraplegia. The assess for which major problem the patient may experience early in the recovery period: bladder control, nutritional intake, quadriceps setting, use of aids for ambulation. So what could be the right answer of this question? Here the answer is nutritional intake. B option. You must have to remember this one. Okay, now we'll come back to next question. The nurse administered levodopa to a patient with Parkinson's disease. Which therapeutic effect does the nurse expect the medication to produce? Increase in acetylcholine production, replacement of the neurotransmitter in the brain, C option, regeneration of the injured thalamic cell, C option, D option, improvement in the myelination of neuron. So here the answer will be the E option, increase in acetylcholine production, E option. Now we'll come back to next question. When receiving hemodialysis, the complication of the removal of too much sodium may occur. Therefore, the nurse should assess the patient for Vostek sign, cardiac dysrhythmia, muscle cramp, increased temperature. Sodium has already been removed. So what will be happen here? Answer is the muscle cramp. You must have to remember this. Okay, C option. Now we'll come back to next question. Which is the best nursing intervention to meet the needs of individual who demonstrate obsessive compulsive behavior, restricting their movement, calling attention to their behavior, keeping them busy to distract them, supporting but limiting their behavior? Here that answer would be the D option. You must have to remember this one. Supporting but limiting their behavior. Now we'll come back to next question. A hospitalized patient diagnosed with a borderline personality disorder consistently breaks the unit rule. This behavior should be confronted because it will help the patient control anger, become more self-aware, reduce anxiety, set realistic goals. So what would be the right answer of this question? Become more self-aware. So B option is the right answer. Okay. Now we'll come back to next question. The nurse teaches patient that they should follow their diet restriction while taking a monoamine oxidase inhibitor. What will develop if they do not follow these restrictions? Suppose patient is taking monoamine oxidase inhibitor. So what diet should be restricted? Occipital headache, generalized urticaria, severe muscle spasm, sudden drop in blood pressure. So here the answer will be the E option, occipital headache. You must have to remember this one. Now we'll come back to next question. A patient is receiving lithium carbonate. While this medication is being administered, it is important that the nurse restrict the patient daily sodium intake, test the patient urine specific gravity weekly, monitor the patient drug blood level regularly, withhold the patient other medication for 1 week. So what would be the right answer? Here the right answer will be the monitor the patient drug blood level regularly, C option. Now we'll come back to next question. The nurse understand that neuroleptics are the drugs of choice to relieve symptoms of E option में psychosis, बी ऑप्शन में डिप्रेशन, सी ऑप्शन में एक्सेसिव एक्टिविटी, डी ऑप्शन नार्कोटिक विड्रॉल। Answer is E option. That is the psychosis. You must have to remember this one. A patient is to be discharged from a psychiatric unit with orders for haloperidol therapy. As part of the teaching plan concerning this medication, the nurse should teach the patient to avoid driving at night, staying in the sun, ingesting egg cheeses, taking medication containing aspirin. Okay, here the answer will be the B option, staying in the sun. Now we'll come back to next question. What is the most important information the nurse should teach to prevent relapse in a patient with psychiatric illness? Develop a close support system, create a stress-free environment, refrain from activity that cause anxiety, follow the prescribed medication regimen. So what would be the right answer of this question? Answer is the D option. Follow the prescribed medication regimen. D option is the right answer. Now we'll come back to next question. Monoamine oxidase inhibitor is prescribed. What should the nurse teach the patient to avoid? Prolonged exposure to the sun, ingesting wines and aged cheese, engaging in active physical exercise, over-the-counter NSAID medication. So here that answer is the ingesting wine and aged cheese. You have to remember this one. Now we'll come back to next question. Patient with diagnosis of bipolar disorder, manic episode, most likely will exhibit sign of passivity, dysphoria, anhedonia. D option में all of the above. So what would be the right answer? Answer is the D option. That is the all of the above. In Maslow hierarchy of physiologic need, the human need of greatest priority: love, elimination, nutrition, oxygen. So what would be the right answer of this question? That answer would be the D option. That is the oxygen. Now we'll come back to next question. The process of assessing patient who queue to emergency department in determining the management priorities is called mirage, triage, leverage, college or college. Answer will be the B option. That is the triage. Glycolated hemoglobin or HbA1c test mean glucose level over 2 days, over 15 days, over 90 days, over 30 days. Answer is the C option, over 90 days. What is the usual site of intramuscular injection? A nurse will choose in an adult for jet tract technique: deltoid, rectus femoris, ventrogluteal, vastus lateralis. Okay, here that answer would be the C option. You must have to remember this one. How do you know that intercostal drainage tube is functioning? Continuous bubbling in water seal bottle, continuous bubbling from suction tube, oscillation of water column in the drainage bottle, no bubbling in the drainage bottle. So answer would be the C option. That's all for the day. See you tomorrow. Hope you all enjoyed a lot. थैंक यू वेरी मच। अगर चैनल को आप लोगों ने नया विजिट कर जरूर चैनल को सब्सक्राइब करिए, लाइक करना मत भूलिए अपने दोस्तों के साथ। थैंक यू ऑल, गुड नाइट टू ऑल ऑफ यू। सी यू टुमारो अनदर इंटरेस्टिंग सेशन व्हिच इज बेस्ड ऑन NCLEX पैटर्न। थैंक यू ऑल।